This is such an exciting time. 2 years ago, I came to this meeting, and I don't think I even heard home-based cardiac rehab mentioned. And at this session, I've heard it mentioned in probably more than 50% of the sessions. So it's really an exciting time, and I hope you guys realize that you're on the surfboard, you're ready, and we're all going to ride this wave. So congratulations. I've been given 5 minutes to tell you about the rationale, the evidence, some examples, and the safety of home-based cardiac rehab. This slide looks at the percentage of patients who referred for cardiac rehab in the National Cardiovascular Data Registry between 2007 and 2012. And as you can see, things are getting better since Randy Thomas published the first performance measures in 2007. The percent of patients participating has gone up from 73% to 81%. But unfortunately, as many of you know, that doesn't necessarily translate into participation. So although the referral rates have gone up from 56 to, in some cases, 80 or even 90% now, participation in cardiac rehab still remains abysmally low. And so it's just really clear that the system is not working for our patients. So one idea would be, oh, well, maybe there just aren't enough facilities to service these patients. Maybe we should build more. Well, it turns out that that actually wouldn't solve the problem. In this study, Dr. Schopfer looked at the participation in cardiac rehab at 124 VA hospitals, and he compared the proportion of patients who participated at facilities that had an on-site program available versus those that did not have an on-site program available. And as you can see, the people with the on-site program did better, but it was still terrible at both. So the highest participation after CABG was 35% at places where they had an on-site program, and only 15% at places where they did not. All right, on to the evidence. So that was easy to prepare because someone else already did the work. This is a beautiful review that was published just last year on home-based versus center-based cardiac rehab. Actually, I will just read the bottom to you. The conclusion was, home and center-based forms of cardiac rehab seem to be equally effective for improving clinical and health-related quality of life outcomes. This finding supports the continued expansion of home-based programs. They looked at various outcomes. They looked at blood pressure and cholesterol, and they compared center-based versus home-based cardiac rehab. And as you can see on this slide, there was almost no difference between the groups. A 95% confidence interval that crosses 0 means that there is no statistically significant difference. So all of these 95% confidence intervals cross 0, and basically that means there's no difference. They also found no difference in smoking and mortality, but the center-based patients were actually less likely to complete the cardiac rehab sessions than the home-based patients. So that suggests that there may be some advantages to home-based in terms of adherence and getting people used to completing their exercises in their home, their regular routine, instead of going to their therapy and then being done with their therapy when they get home. As far as examples, the UK's been way ahead of us. They've been doing this for over 20 years. They have a heart manual, and they have a whole training program, and they give this to patients after PCI or CABG and help them through it. It's a 6-week program. This was a systematic review of the heart manual literature that was published in the European Journal of Cardiovascular Nursing about 5 years ago. And they concluded that the evidence from randomized trials suggests that the heart manual is as effective as hospital-based cardiovascular rehab on psychological, behavioral, and biological outcomes. I would actually argue that facility-based rehab is not the relevant comparison for patients in these kinds of trials, because patients who can go to facility-based rehab should go to facility-based rehab. It's a great thing. It reduces mortality. The problem is that 80% of patients don't go. And so what we want to do is find an alternative to not going to cardiac rehab. The 20% can still go to their center-based programs, but when you're comparing home-based rehab, it should really be to nothing, which is what's happening now. I told Bob that this was his moment to bask in the sun. Research does take a long time, but in this case, 22 years since he had this idea where you could do a case management system for coronary risk factor modification after acute MI. And he actually conducted a randomized trial of 585 patients at 5 Kaiser Medical Centers in California, comparing home-based cardiac rehab versus usual care, which is the appropriate comparison. And in that trial, there were 293 patients in the home-based cardiac rehab arm and 292 in the usual care arm. And the home-based cardiac rehab patients were more likely to stop smoking, they had lower LDLs, and they had higher exercise capacity. Good job, Bob. There's also evidence that smartphone-based home care models can improve care. In this case, they did a randomized trial of 120 patients who had acute myocardial infarction and looked at smartphone-based home cardiac rehab versus center-based cardiac rehab. And they found greater uptake, adherence, and completion of cardiac rehab in the smartphone-based group. All right, Harsh asked me to just say a few words about safety. A lot of people are concerned about patients being safe at home and exercising, and what if my patient has VFib and dies at home? So it, of course, is an important topic, but the fact is that people are gonna die of VFib, period. And I don't think teaching them to exercise is going to really increase the likelihood that that's going to happen. Maybe it'll happen when they're exercising, but those people are going to end up having VFib anyway. And I think that the alternative, we all have to take risks. We all have to cross the street every day and take the risk of being hit by a car. So there is, we do have to assume some risk with home-based rehab, but it's very, very small. So this was a study of over 5,000 exercise studies that were done in 4,250 high-risk patients. And so they really took the sickest people with CHF, hypertrophic cardiomyopathy, pulmonary hypertension, aortic stenosis, and so on and so forth. I like how they put women as one of the high-risk categories. And they found that there were no deaths, but adverse events only occurred in one of 625 studies. Another study looked at the heart failure action patients and found in this randomized trial of over 1,000 patients with heart failure who had reduced ejection fraction, so these are by definition the ones that are at risk for having VFib, the number of defibrillator shocks between the groups was the same. So in summary, cardiac rehab remains vastly underutilized. New patient-centered delivery strategies are needed. Similar outcomes for home and center-based cardiac rehab have been proven, and implementation is feasible and effective. So let's all ride the wave.